Good evening, everyone. My name is A.Varoniukaite, and with my supervisors, we would like to present a case of choroidal neovascularization in myopic patient. So this is a clinical case of 48-year-old woman with moderate myopia. The patient's first visit to our department of ophthalmology was in early 2018, and she was complaining of metamorphopsias lasting for 5 days in the right eye and reduced visual acuity for a year. The patient's visual acuity in the left eye was poor for a few years already. At presentation, her best corrected visual acuity in the right eye was 0.5 and in the left eye 0.02 with normal intraocular pressure. On clinical examination, we found in the right eye optic nerve drusen, subfovealar dyspigmentation with edema and hemorrhages, and in the optic coherence tomography, we saw active choroidal neovascularization. So first short question for you would sound like this. Which diagnostic method is used to confirm active choroidal neovascularization? You can see the number A, B, C, or D here, but I think it's a quite easy question, and the answer is OCT angiography or fluorescein angiography. In this case, active choroidal neovascularization was confirmed by OCT angiography. Another short question, maybe were there any other important changes visible in the provided fundus photo? And if you look closely, yes, there were. In this short video, I would like you to see the progression of patients' active choroidal neovascularization and formation of a scar in the optical coherence tomography imaging. Yes. And another short video is also really important because in this short video, we are able to witness the progression of this patient's fundus lesions and lesions in the right eye. And it progressed during the years 2018-2020. And as you can see, diagnosis becomes more clear as the disease progresses. So these are the pictures from the patient's first visit in our department and the last visit. And as you can see, there are some findings like angioid streaks that were very subtle at the first visit, and the diagnosis is quite clear at the patient's last visit. And what is really important, that we already knew the diagnosis from the beginning. You will know in a second why. But after further investigation, the patient admitted having some yellowish skin lesions on the side of her neck that were present for quite a long time. So in this case, what is preferred management tactic? Observation, intravitreal injections, photodynamic therapy, or laser treatment? Well, the answer is, of course, B. And the treatment of intravitreal vascular endothelial growth factor injections was started, as up to this day, 13 intravitreal injections were administered. What is important that after first few injections, the patient's best corrected visual acuity increased from 0.5 to 0.8. But after 3 injections, the patient disappeared for some time as 4 months due to some personal reasons and to mental health issues. And as you can see, after renewal injections after a 4-month gap, the patient's best corrected visual acuity gradually decreased to 0.07 in the last visit. So, what is the diagnosis? CNV secondary to myopia, to age-related macular degeneration, or C, to angioid streaks in pseudoxanthoma elasticum. And as I think you already know, the correct answer is C. And what is really important in this case, in this picture you can see the pictures of both eyes in this patient at the first and at the last visit. And as you can see that it's quite clear from the beginning, looking at patient's left eye, that there are angioid streaks radiating from the optic nerve disc to the periphery of the retina, and one of angioid streaks are already going through the macula and fovea region with fibrotic degeneration and cystic intraretinal fluid. Also, other methods are really important in diagnosing rare diseases like this. For example, autofluoresceins, and you can see how hyperreflective optic nerve drusen are and how well we can see angioid streaks in this case. So what are those? Shortly, they're bilateral, irregular, crack like the hindrances of a Bruch's membrane that surround and radiate from the optic nerve disc, and usually retinal pigment epithelium is intact. But if subretinal pigment epithelium neovascularization happens, that can complicate angioid streaks. And choroidal neovascularization, of course, can result in a disciform scar. The most common causes of angioid streaks can be put in the mnemonic, TEPSI-HAM, easy to remember. And pseudoxanthoma elasticum is the most common cause of angioid streaks, about 60 to 87% of all cases. It's like, and pseudoxanthoma elasticum is rare autosomal recessive connective tissue disease, characterized by fragmentation and calcification of elastic fibers due to mutation of the ABCC6 gene. It is quite rare and manifests not only ophthalmologically, but dermatologically. Most prominent feature is yellowish plaque-like skin lesions, firstly on the lateral neck and later in other parts of the skin, and cardiovascular system manifestations. In ophthalmology, of course, angioid streaks, as I've already mentioned. It can be macular atrophy, central vision loss, choroidal neovascularization, subretinal hemorrhage, fibrosis, and other important finding. It's like pathognomical for pseudoxanthoma elasticum, and you can see it written in French. I won't pronounce it, but it's like a dappled appearance of the macular region resulting from small dark areas in lighter part of the retina that is resembling of a peel of an orange. The incidence of angioid streaks in pseudoxanthoma elasticum varies, and incidence of choroidal neovascularization secondary to angioid streaks varies between 42 and 87%. Diagnostic methods include red-free retinography, autofluorescence, OCT, OCT angiography, fluorescein angiography, and treatment options include like historical ones like laser photocoagulation and etc., and the new gold standard, vascular endothelial growth factors, and in most factor inhibitors. And in most studies have shown that vascular endothelial growth factor inhibitors, they are effective to improve and to stabilize the visual acuity in long-term follow-up for these patients. But however, despite the currently available treatment, the disease can only be limited, but not permanently inactivated. So thank you for your attention.